What I'd like to discuss today is how the business community sees Frankfurt. That's what Leaky Bucket 1 was all about. And we released that study in 2009. And as Diana mentioned, it, I think, got a little traction. It basically created a framework by which the business community could discuss issues in Frankfurt. We decided a few years ago, I knew as I got acclimated to Frankfurt when I returned to Kentucky in 2005, that almost every issue in Frankfurt involves money, whether it's education or transportation, just anything. It all kind of comes down to money, and frankly, I didn't think we were prepared to have the discussions in Frankfurt that we needed to be able to have. So, with a plan that we needed to be smarter, we engaged the University of Kentucky and Professor Ken Trotsky and those economists over there to analyze 20 years of budgets in Kentucky compared to the economy. And then we got Taylor Gray to start working on some projects there about how we're spending our money, and that's what Leaky Bucket was about. Leaky Bucket 2, which we're unveiling today, is a report on how that has gone. So I think you all have Building a Stronger Bucket at your place setting, and this is your guide to how we see things in Frankfurt in terms of major drivers of some of the spending issues. We have a set of 10 paintings in our offices in Frankfurt in the AT&T video conferencing room that together are displayed as a representation of the economy of Kentucky. Everything from logistics to coal to river traffic, horses, bourbon, all that makes up the economy as we talk about our state of Kentucky. If you reduce that economy, which is the gross domestic product, that's the most popular way of portraying an economy, down to $1, state government for the last 20 years, or almost 20 years, has been approximately 6%. What ends up in the general fund is about 6%. Now, if you look at the graph, and this is in the report, this is not the most exciting chart you'll ever see, but it's an important one, all right? A lot of movement in this chart. On the left side, 1991. On the right-hand side, 2009, the latest figures we have. And what it shows, these are percentages over here. So state government is 6% of the gross domestic product, the economy of Kentucky, and runs pretty consistently all along. And this last year, in part due to the recession, actually went above 6% for the first time. So state government as a part of our economy is as large or larger than it's ever been. What's interesting, if we could back that chart back a few years, into the late 80s, you would see that state government was about a nickel. The last major tax increase in Kentucky was CARA, Kentucky Education Reform Act. The lottery kicked in at about the same time, but it was a fraction of what the tax increase for CARA was. Those two things took state government from being about a nickel out of every dollar to 6 cents. That's important to keep in mind because there are those who believe, on one hand, that state government has just exploded and it's just taken over everything, and the size has just increased and more taxes and all that. That's not true. On the other hand, you have some people who think that it has been starved to death and we need more tax revenue to try to get it back up. I frequently hear the question from well-intentioned friends of mine who ask, when is the business community going to step up and support education the way they did in 1990 when David Jones, Oz Nelson, and John Hall, three corporate titans at the time, barnstormed this state calling for education reform. Their message was a fairly simple one. We're 49th and we're not going to take it anymore. We've got to do something. And the business community, including the Kentucky Chamber of Commerce, proudly promoted the idea that we need to step up and jumpstart our schools. So that was the last major tax increase, and went from a nickel to 6 cents, and we've been rocking along at about 6 cents ever since. So we approach with some reluctance those in Frankfurt who immediately, when there are money problems in Frankfurt, when they immediately have the reaction that, oh, we need more money. We need to find new revenue. The Kentucky Chamber is not ideologically opposed to new revenue, as in the early 90s on education reform, and more recently for a cigarette tax because of its health benefits and discouraging young smokers. The Kentucky Chamber has been on record occasionally for revenue, but not to bail out state government, but to use it in strategic ways. Now, this is the chart that was in the 09, this is in the report you have, but there was a similar version of this in the 2009 report. Let me show you what this is. This chart is a little bit more exciting than the previous one. The first stack of coins shows the growth of Kentucky's economy from 2000 to 2012. About 42 or 40, well, it's on there, 42.6%. That's the gross domestic product has grown that much. The next one, the bucket, that represents the state's budget. Almost identical growth, 41.4. So again, regardless of what you want to say about the tax system, and we have our own set of problems with the tax system, but it is producing revenue that's commensurate with the growth of the economy of this state over at least a 12-year period. The next one is corrections. That's our propensity to put people in prison. And we'll come back to that in a minute. The next one is Medicaid, and that's just the state's portion of Medicaid, not the federal. The state's portion of Medicaid has grown tremendously. Part of it, in fair disclosure, is related to the economy and more people in need during a Great Recession. The next one, public employee health care, has grown 5 times faster than the state's budget, 5 times faster than the state's economy. And we'll come back to that in a minute. Now, folks have said and have asked questions, well, wait a minute. Everybody's health care costs have gone up. If you're Toyota, if you're a small company on Main Street, your health care costs have gone up. If you compared that stack of coins to the average increase in health insurance nationwide, that stack would be about half as tall if we had simply held it to the national increase. So it is clearly an aberration in the state's budget and distorts the state's budget. Now the next one, the shorter column, is P12 Education. That's the money that goes into the SEEK formula by which the Frankfurt sends money to your school superintendent to keep your schools open. The SEEK formula. And to the credit of the legislature and the governor, past 2 governors, they have attempted to hold the SEEK formula harmless during all the cuts and the cuts and the cuts. They've tried to maintain basic funding for education. But there's a little bit of deception there in the sense that the next column that you can barely see on the chart is non-SEEK education money. That's summer schools, that's teacher training, it's the Department of Education, some very important stuff, and that portion has been just hammered during the last 12 years. The last column, for those of you with KCTCS and the universities, that's higher education. Clearly has not kept up with the growth of the state's budget, clearly has not kept up with the growth of the economy. Where do they end up making up their money? Tuition, which is a tax. But just a more hidden tax. So this is our concern about state spending. Now, good news is, we're going to come to in just a minute, is that there has been substantial progress. The short version of this talk is substantial progress, but not enough. That's what we're going to get into in just a minute. The leaks in the bucket, the big dollar leaks. I'm sure there are others if you drill down into agency budgets and all that, but the big leaks, corrections, Medicaid, public employee health benefits. Now, here's a real concern. It's not just a taxpayer like the business community saying, wow, we don't like our tax dollars being spent that way. But if education had held its piece of the pie for the last 12 years, we would have had this year, 2012, we would have had $276 million more dollars to spend on education. That's about a 7% increase for teachers, for schools, for students, if education had not been diminished by the pressures from the leaks. Okay? And education is the top priority of the Kentucky Chamber of Commerce. So, we released Building a Better Bucket, a Stronger Bucket. In corrections, there's been real progress, and I see President Williams back here. The legislative leadership created a climate by which Democrats and Republicans, House and Senate, could come together, along with the Pew Center for the States, to address this issue. Now, this chart shows prison growth from 2000 to 2020, and this was the projection before their reforms. Look at the population, the prison population going up there. In 2008, I don't know about 2009 and 10, but in 2008, we were the #1 state in the country at the rate at which we were incarcerating people. And over 20% of people who went into prison in 2010 were there for probation infractions, not additional felonies. Well, we all want to be tough on crime. We all want safe neighborhoods. Well, you factor in the fact that it takes about $20,000 a year to put somebody in prison. It takes about $8,000 or $9,000, I believe, to send them to high school. It takes about $6,000 or $7,000 of state dollars to send them to the community college or university. $20,000 to put them in prison. Very expensive. So the legislature came along and did a terrific job with House Bill 463, the key goals of which were to strengthen probation and parole, adopt common sense sentencing reforms, supporting and restoring victims, improving government performance. Let me back up just 1 second there. Basically, there was a rewriting of the criminal code in common sense ways, again, with all the players at the table. You know, there's a reluctance in Frankfurt to do anything about the penal code because somebody might accuse, your opponent might accuse you in your next election of being soft on crime. So the fact that an atmosphere was created by which these reforms could take place, this was monumental. I would argue that this was the most substantial thing that happened in the last legislature. Very significant. $424 million estimated will be saved over a 10-year period. Half of that will be put back into drug treatment programs and things that are less expensive than putting somebody in prison. The other half will be just raw savings to the state of Kentucky. That's when Frankfurt works and works well and gets progress made. Our recommendations: full implementation of that House bill and protect savings to the general fund. In other words, don't get eager to say, oh, we've saved some money, let's spend it on X or Y or Z. Let's capture those savings and let's stay the course on implementing House Bill 463. In the area of Medicaid, you know, the governor flew around last week making his announcement that there were 3 new companies picked to do managed care. One of the recommendations in our Leaky Bucket 1 was that we ought to expand managed care. And I'm not an expert in that area, so I'm not about to try to explain all that. But the Louisville area is really the only area of the state that has had managed care through the Passport program. And we basically said, it's working, let's spread it statewide. Some people said, no, it can't be done, it's not feasible, on and on and on. Well, last week was the announcement that 3 companies have been hired to do that, and it'll save buku of dollars according to the proposals that are out there. Here's Medicaid eligibility growth. It's just skyrocketed. There are now more people enrolled in Medicaid in Kentucky than all the students and college students that we have in our public schools, colleges, and universities. More people on Medicaid. And that's before the federal health care law kicks in, and Medicaid is expected to expand by 35 to 40%. Now, the federal government will pay 100% of it for a while, and then we don't know. I've described Medicaid as kind of the locomotive that's coming down the track at the state capitol because almost all budget projections are inadequate unless you make some assumptions about Medicaid and how in the world do you do that in the current health care environment. Chamber's recommendation: implement the managed care solutions. You heard a couple of speakers yesterday talking about the challenges of doing that in the short time frame that the administration has given them, but we have to hope that that gets implemented well. Promote wellness activities and incentives. Not just saying to Medicaid recipients or to state employees that wouldn't it be nice if you exercised and felt good about yourself, but actually put some financial incentives there. And more health insurance. I know at our office we have a bonus program. You can earn up to $500 a year by doing certain things, like getting a physical, by taking the wellness assessment and that sort of thing. We're having a contest. I've got a pedometer. That's why I'm walking around the stage. I'm getting points while the staff's sitting back there. 4,427 steps today. None of them aerobic. Oops. But I'm getting points. So, Medicaid, that's the biggie. And I don't know how the legislature and the governor is going to, long term, it's really troubling. Also, we are calling for, in this report, a data-driven review. Sort of like bringing in the Pew Group, the Pew Center for the States, to help us with corrections. We feel like it would be important to have folks who are expert in this area come in and do a top-to-bottom review of Medicaid. Now, public employee health insurance, and I have to walk carefully on this one. My wife's a retired teacher. But Clearly, it's an unsustainable trend in what we've been spending on health insurance. The legislature, to their credit, came along this last time, again, Republicans and Democrats, and basically capped the amount of money they were willing to spend on that. And they went a step further. They said, in the legislation, here's the health plan we're going to provide for state employees now. Well, they passed it. House, Senate. Went to the governor. The governor line item vetoed that section. I was with him later that evening. I said, Governor, the legislature did the heavy lifting there and gave you cover. Why did you veto it? And he said, well, I was concerned that they tied my hands on how we would implement it. And he said, after all, we're going to have to meet those budget numbers, so not to worry. Well, and eventually they came back and they implemented it. There were several things done. They increased premiums for public employees, not unusual in the private community. That's commonplace in the private community. Limited increase in the state government's contribution. No employee contribution required for the basic plan, so they continued 100% of the basic plan. How many companies do that these days? Higher employee contributions for more generous, the quote Cadillac plans. Increased deductibles and co-pays, and 2/3 of employees select single coverage under one of the 3 highest options. So basically it was an incentive, a pocketbook incentive, to move toward the basic plan, which was 100% provided. A lot of savings in that regard. Our recommendations: continue increased employee cost-sharing methods and put an emphasis on employee responsibility. Companies are doing that. Promote incentives for wellness activities, financial incentives, not just pats on the back, but just say, by the way, your insurance premium is now tied to whether or not you smoke or have a wellness exam, get a physical, etc., etc. Now, one area in the 2009 report, and this was probably a weakness of our report in 2009, we were quite enthusiastic about the reforms in pensions in 2008 in the legislature. We mentioned it in the Leaky Bucket one, but not enough. Well, we've got a bit of a crisis situation with pensions, and so we've given it more attention in this one. The Pew Center for the States, a nonpartisan group that does a lot of analysis, just rated Kentucky below par, one of the lowest states in terms of our unfunded liability and the resources we're putting to try to address that. Kentucky's retirement system's funded at 58% of the $36 billion in liabilities that those systems, there are multiple systems, that those systems have. The national average is 78%. Yeah. No wonder the rating agencies have given us a negative view. And by the way, the contribution from the legislature to those, I think, is at 58%, and the national average is 64%. So we're out of sync in a couple of ways there. And by the way, there's a teacher system that has made significant progress. There are the state employees that have the police and the state police and others. It gets complicated, but it's outlined in the report if you want to dig into it. So why do we have that? Why is it so out of whack? A, we overpromised. In good times, it was easy to say, all right, we're going to help public employees and give a little bit better pension, a little sweeter deal. In bad times, if you couldn't give a salary increase, you'd say, well, we can give you something on this side, and by the way, we'll pay for that in 20 years. So it was overpromised, underfunded. The stock market performance has been bad. That's affected everybody. And poor investment decisions, and that's a whole other realm. The investment committees didn't even have investment expertise on those committees in some cases. And we're very, very slow to diversify investments when most of us in the 1990s were being told, yeah, you need to have a little international in your portfolio and this and that. There was resistance to that in the pension systems. So the Chamber's recommendations: reduce health insurance costs, because that's pulling money away from the retirement, the integrity of the retirement programs. Suspend the COLA, cost of living adjustment. Adopt a defined contribution plan, 401k type of plan. And I know there's cost involved with doing that on the front end, but we've got to do that to make these public employees. And this would be for future employees. This wouldn't be just yanking somebody's pension. It would be to deal with it for the future. We've got to come to that. And emphasize total compensation. More and more of our companies are doing that. We do that at our shop. We let, a person has a salary, but they get health care, they get a 401k match, they get this and that. vacation, and we add all that up and we show folks, by the way, your total package is this. And we think that's important just for people to know what all they're getting as a part of their package.